OSHA's rule on crystalline silica. Training on what you need to know. Overview. Health effects of silica exposure. Controls and PPE requirements. Written exposure control plan requirements. Medical surveillance requirements. What is silica? Crystalline silica is a common mineral that occurs in many naturally occurring and man-made materials used at construction sites. Respirable crystalline silica is very small particles, typically at least 100 times smaller than ordinary sand found on beaches or playgrounds. What is silica? The very small pieces of silica dust get in the air that you breathe and become trapped in your lungs. Inhaling very small crystalline silica can be hazardous to your health. When is exposure likely? Respirable crystalline silica is generated by high energy operations on stone, rock, concrete, brick, block, mortar, cement, and tile. You could be at risk. Exposure has been found when employees perform one of these tasks: grinding, crushing, hauling, chipping, hammering, drilling, sawing, blasting, dry sweeping, compressed air, mixing mortar or concrete. What is silicosis? Silicosis is an irreversible, often disabling, and sometimes fatal fibrotic lung disease. Chronic silicosis is the most common type of silicosis and usually occurs after at least 10 years of exposure to respirable crystalline silica. Accelerated silicosis may occur within 5 to 10 years due to high levels of exposure. Acute silicosis may occur within a few months to less than 2 years due to extremely high levels of exposure. Silicosis symptoms. Symptoms of silicosis may include shortness of breath, cough with or without blood or mucus, fatigue or weakness, night sweats, fever, and loss of appetite may indicate other diseases associated with silica exposure, such as TB infection or lung cancer. Note, there may be no symptoms in the early stages of the disease. Other health effects of silica exposure. National Toxicology Program and the International Agency for Research on Cancer list respirable crystalline silica as a known human carcinogen. Silica exposure has been associated with COPD, including chronic bronchitis and emphysema, several types of kidney disease, including end-stage renal disease, autoimmune conditions, including progressive systemic sclerosis, systemic lupus erythematosus, and rheumatoid arthritis, increasing an employee chances that latent TB will develop into active pulmonary TB infection, lung cancer. OSHA's new silica standard. OSHA issued a new silica standard 29 CFR 1926.1153 that requires employees use engineering controls, work practices, and PPE when exposed to respirable crystalline silica dust. Employees receive medical examinations under certain circumstances. Employees receive training on respirable silica and understand the controls and PPE in place to protect them from exposure. Employers develop a written exposure control plan. Employers understand the exposures to employees. OSHA's new silica standard, PEL, permissible exposure level. The employer must ensure that no employee is exposed to an airborne concentration of respirable crystalline silica in excess of 50 micrograms, calculated as an 8-hour TWA. What can you do to protect yourself? Know the tasks and materials that can generate silica dust. Understand OSHA's new silica standards requirements. Use the engineering controls as instructed. Follow the work practices and manufacturer instructions. Use the proper respirator. Review the written exposure control plan. Avoid working in dusty areas when possible. Attend medical screenings if required. Follow your doctor's instructions. Practice good personal hygiene. Do not eat, drink, or use tobacco products in dusty areas. Wash hands and face before eating, drinking, or smoking outside dusty areas. Do not use compressed air on clothes or surfaces. Do not engage in dry sweeping of small dust particles. Bring a change of clothes and change before getting into your car whenever practical. Use engineering controls. Engineering controls. Employees must use engineering controls for silica exposures above the PEL. Those controls must include either wet cutting or vacuum dust collection systems. Understand the proper use of engineering controls and use them accordingly. If you are unsure how to use the controls or a problem arises, notify your supervisor immediately. Properly inspect, use, and maintain the engineering controls. Large amounts of visible dusts or a noticeable increase in dust generation during a task generally indicates that controls are not fully and properly implemented. Operate according to manufacturer's instructions. Employees must operate equipment in accordance with manufacturer's instructions. Review manufacturer's instructions for each piece of equipment. Follow work practice controls. Work practice controls. Work practice controls for silica exposures involve performing tasks in a way that reduces the likelihood or levels of exposure. The work practice controls will vary based on the task and equipment used. Examples: shift work, restricting work area access, avoiding indoor sawing when possible. Wet methods. Full and proper implementation of water controls requires that employees ensure that an adequate supply of water for dust suppression is used. Flow rates specified by the manufacturer are used. The spray nozzle is working properly to apply water at the point of dust generation. The spray nozzle is not clogged or damaged. All hoses and connections are intact. Water filters are rinsed or replaced often. Water is replaced or changed when it gets gritty or begins to silt up with dust. Dust controls. Full and proper implementation of dust collection systems requires the employer to ensure that shroud is intact, encloses most of the grinding blade, and is installed in accordance with the manufacturer's instructions. Hoses and connections are intact and without kinks or tight bends. Vacuum has enough suction to capture dust at the cutting point. A HEPA filter in the vacuum exhaust is used. The HEPA filter are cleaned or changed in accordance with the manufacturer's instructions. The dust collection bags are emptied to avoid overfilling. Follow housekeeping requirements. Housekeeping. Do not engage in dry sweeping or dry brushing where such activity could contribute to your exposure to respirable crystalline silica. Use wet sweeping and HEPA filtered vacuums whenever feasible. Do not use compressed air to clean clothing or surfaces. Use respiratory protection. Wear your respirator while installing or implementing controls or work practices. For tasks where engineering controls and work practices are not feasible. When engineering controls and work practices cannot reduce exposure to below the PEL. Whenever your supervisor requires it. Ensure that your respirator is properly fitted and perform a seal test every single time you put your respirator on. Review the WECP. Employers are required to implement a written exposure control plan. WECP will provide a description of the tasks that involve exposure to respirable crystalline silica, a description of the engineering controls, work practices, and respiratory protection used to limit employee exposure to respirable crystalline silica for each task, a description of the housekeeping measures used to limit employee exposure to respirable crystalline silica, and a description of the procedures used to restrict access to work areas to minimize the number of employees exposed to respirable crystalline silica in their level of exposure. Know who the competent person is. Competent person. A competent person will be designated to implement the written exposure control plan. Competent person is an individual capable of identifying existing and foreseeable respirable crystalline silica hazards, is authorized to take prompt corrective measures, and has the knowledge and ability to implement the written exposure control plan. The competent person will be identified on the written exposure control plan. Your competent person is your foreman and/or project manager. Follow restrictions. Restricted access. Access will be restricted to essential personnel only when employees are engaged in silica generating tasks that require the use of a respirator or when exposure is above the PEL. Work areas will be restricted by one of the following: scheduling certain tasks when others are not around, telling employees to stay out of areas where dust is generated, moving employees to areas where they are not exposed to dust, post warning signs, cones, or barrier tape. Attend the medical surveillance. Medical surveillance. The employer is required to make medical surveillance available at no cost to each employee who will be required to use a respirator for 30 or more days per year. OSHA requires medical exams so that your health can be monitored for the health hazards associated with respirable crystalline silica. Medical surveillance. All medical examinations and procedures required by the Silica standard are performed by a physician or licensed healthcare provider. The exam includes medical and work history, TB test, physical exam, chest x-ray, and pulmonary function test. Frequency of the exams. Exams will be offered within 30 days of initial assignment unless you have an examination that meets the requirements of the Silica standard within the last 3 years. Every 3 years from your last examination or more frequently if recommended by the PLHCP. A dated copy of your last PLHCP's written medical opinion must be provided so we can determine when the next periodic medical examination must be performed. What information must be provided to the PLHCP? The examining PLHCP must be given a copy of the standard, a description of your past, current, and future duties as they relate to crystalline silica exposure, your past, current, and future levels of exposure, or the use of a respirator under Table 1, which indicates likely exposure at or above the PEL. A description of any personal protective equipment used or to be used by you, including when and for how long you used or will use that equipment. Information from records of employment-related medical examinations previously provided to you and currently within the control of the employer. Medical report. PLHCP's written medical report for the employee. The PLHCP must explain to you the results of the medical examination and provide you with a written medical report within 30 days of each medical examination performed. Only you receive this written medical report. What must be in the written report? PLHCP's written medical report for the employee. Your written report should contain a statement indicating the results of the medical examination, including any medical conditions that would place you at increased risk of material impairment to health from exposure to respirable crystalline silica, and any medical conditions that require further evaluation or treatment. Any recommended limitations on your use of respirators. Any recommended limitations on your exposure to respirable crystalline silica, and a statement that you should be examined by a specialist if the chest x-ray provided is classified as 1/0 or higher by the B reader, or if referral to a specialist is otherwise deemed appropriate by the PLHCP. What information must be provided the employer? PLHCP's written medical opinion for the employer. The employer will obtain a written medical opinion from the PLHCP within 30 days of the medical examination. The written opinion will contain the following: the date of the examination, a statement that the examination has met the requirement of OSHA standard, and any recommended limitations on the employee's use of respirators. Additional information: PLHCP's written medical opinion for the employer. If you provide written authorization, the written medical opinion also may contain the following: any recommended limitations on the employee's exposure to respirable crystalline silica, a statement that the employee should be examined by a specialist. Employee notification. Employee notification. You will receive a copy of the written medical opinion given to the employer within 30 days. Follow HAZCOM. Hazard communication. Respirable crystalline silica is part of the hazardous communication program. Respirable silica is considered a hazardous chemical that can result in serious health risks. Understand all labels on containers of crystalline labels. Access safety data sheets in your foreman's truck or on the R.W. Shekels website. If you have any further questions, please contact a representative of Robert W. Shekels.